The physicians at Garrett Regional Medical Center are complaining that they are not receiving the results of the testings that are being done within the organization. A case study is completed to evaluate how many tests are sent out and how many times the results neglected to reach the ordering providers. The purpose of the case study is to decrease the number of reports that are not being received by the appropriate provider. The goal will be to decrease the amount of reports that are not being received by the ordering providers by 50% overall by July 2018. Before we can come to a solution, we must first understand what the problem is. The reports that are not getting to the providers is going to delay treatment to these patients, and it directly affects the patient's care. It has a large impact on the patient satisfaction when the reports are not getting to their ordering physicians and they can't get their treatment done fast enough. Then the patients are not happy and the physicians aren't happy as well. The long-term impact would be that the reimbursements and the patient outcomes are much lower. The reimbursements can be directly related to the patient satisfaction. And if the patient's outcomes are not higher, then the reimbursements can certainly be lower. In order to understand the problem, we must track the problem. We started with each department and followed the reports through to the provider. We ask each person that handles the reports why they might feel that the reports are not reaching their destination. The problem is important because it directly affects patient care. It can have a direct impact on patient and physician satisfaction. It can increase unnecessary repeat testing and increase the time employees spend on correcting these errors. It can also increase the time it takes for a physician to be able to treat that patient. It can have a financial impact on the organization by directly affecting the patient and physician complaints. It can affect the reimbursement rates. This chart demonstrates the amount of time that each department spent on correcting the errors. The blue shows for the HIM department, the purple the radiology department, the green for the laboratory, and C for the cardiopulmonary, or red rather, the red for the cardiopulmonary department. You can see most of the time that was spent was between the radiology and the lab department, but any of this time is wasted time. And this demonstrates the financial impact on the organization. This is the financial impact broken down by departments. As you can see again, the lab and the radiology department are at the highest here, but all of this money and the financial burden just doesn't come to the organization. The financial burden would be on the patients as well, because their outcomes are being delayed, their treatments being delayed. The team reached out to every step that the reports go through. Some of the complaints that were received were the physicians were not receiving reports. The in-provider registries needed updated. The physicians' orders were not always legible at the registration desk so that they could get the appropriate information into the computers and the correct numbers for those reports to go to. Some of the other problems that were reported were outsourced problems, such as the physicians lacking to get their own reports. This would be when the physicians had to retrieve their own reports via mail or off of their own fax machines. So they just didn't bother to pick them up. Electronic interface problems. Sometimes the faxes would just fail or the computers would just not go through. Staff was unable to get faxes to go through due to busy signals and the fax lines being tied up from overuse. It was decided in order to find a solution to this problem, we needed to create a Lean Six Sigma team. The team meets for 2-hour segments to collect data and discuss the problem, possible solutions, and outcomes. The team evaluates how many tests are sent out and how many times the results neglected to reach the providers. The team consists of all involved parties: staff from radiology, cardiopulmonary, laboratory, registration, IT, HIM, and someone who can represent the physician's offices. The data is collected from an approximate 5-month time frame. Data is collected from April 15, 2017 to August 2017. There was approximately 18,193 reports that were sent out from the departments that were listed. Of those, 755 reports were not received by the providers. The data included reports from radiology, cardiopulmonary, and laboratory. However, the laboratory results were not able to be collected from the month of April. So you ask, why is this important? How does this affect the organization? Well, most importantly, it affects the patient's care. If the physicians do not get the reports from their patients, then they are unable to treat the patients for the necessary care they need. In essence, if the patients are unable to be treated, then this is going to decrease the physician's confidence and the patient's confidence in the organization. And it can ultimately, in the end, impact the reimbursement rates for the organization. What were the influences of this reporting project? First and foremost, it was a way to implement an improvement project. It was a way to demonstrate patient-centered care for the organization. It also demonstrated the ethical goal. A healthcare professional provides a caring response patient relationship. The reporting project is an opportunity for performance improvement. Defining the quality of care depends widely on who is defining quality and how they are measuring it. Edward Deming defined quality as a never-ending cycle of continuous improvement. Quality is defined as the person who is receiving the care. In the past, quality was looked upon primarily by the care that it was given to the patients. Today, it's becoming increasingly important to take a closer look at how those who are receiving the care perceive it. This is an example of quality improvement. Another major influence of the case study was that it is affecting the quality of patient care. Patient-centered care is at the center of the quality in healthcare. The problem creates a gap in the physician-patient relationship and delays the immediate treatment for the patient. The patient is the reason that the organization must strive to deliver the appropriate results in a timely manner. The relationship between the physician and the patient is at the heart of providing the best possible care. By putting a gap in that relationship, the organization is letting both the providers and the patients down. By improving this process, quality patient care is improved. The last influence is the ethical goal in providing a caring response. The ethical goal of healthcare professionals is the caring response patient relationship, a relationship that honors patient dignity. It is a combined effort among the healthcare professionals to make certain that this occurs. The highest results are reached when the efforts are well coordinated by the entire team and everyone works together. 3 possible solutions were looked at to correct the problem. It was looked at to leave the current system into place and just make improvements, to use a newer technology, an email reporting system where reports are emailed to the providers, or a physician retrieval system where all reports would go into a single database and their physicians would retrieve their own reports. By leaving the current system into place, it would be less expensive on the organization and less timely for the employees to learn. However, by using the current system, there is the possibility that no change would occur and the problem could possibly worsen. Some of the improvements that were looked at to use the current system would be adding an additional fax line, educating department leaders on using the software system, and updating the physician registry. An alternative to the current system was introducing an email web-based faxing system. This is where physicians would no longer get a faxed paper report and they would get their reports via email. The pros to this system was that it would be more secure for those reports and we would no longer experience busy signals. However, this program is expensive and the training time it would take to train employees on this and the internet dependence could definitely present a problem. Physician retrieval was the third alternative that was looked at. It was not popular with the physicians, but it did add some benefits to the staff. The reports would automatically flow into the system, and the availability of old files would be a benefit for physicians. However, the physicians did not like the idea that they would have to go in for their own reports, and it was also expensive for the organization. The solution that was determined to go with was leaving the current system in place and implementing some improvements. The team decided that by adding an additional fax line Educating and training the department leaders on the faxing monitor system and updating the provider registries would possibly be a temporary solution for this problem. The first step in the implementation plan would be the addition of a new fax line. The hope is that the new fax line would cut down on busy signals and allow the reports to go through more successfully. The second step would be to educate leaders on the monitoring of those reports and pushing the failed fax reports through more regularly. The third step would be the immediate and ongoing update of the provider registries. The registries would be needed to be updated with all the provider numbers and ensure that the numbers that the system had in for each provider was correct. And as new providers ordered testing, to be certain that those provider numbers were getting into the registry. The team will continue to meet to monitor the progress. The meetings will be pushed out from each week to once a month. The department leaders will be expected to keep daily logs of all the reports that have either failed or not made it to the ordering providers. The team will keep these logs so that they can be reevaluated and a decision can be made in July 2018 to whether this current process is working or one of the alternative solutions needs to be reevaluated. References. Thank you for joining me for this presentation of the reporting project.